afternoon. Well, today morning when I took a flight to Mumbai, I was reading a newspaper and one of the articles that caught my eye, it was talking about health is wealth. It's not a new statement, but there was a very large article on health is wealth, and it talked about food habits, how they are changing and how people are looking at genomics, using genomics and to build their better food habits that will build a better health for them. And with that in mind, I was having a discussion with Pranav just some time back, and we were talking about how genomics is trying to change the practices in terms of building health. And today I want to talk about, from Siemens Healthineers point of view, what we are trying to do. We pioneer breakthroughs in healthcare for everyone, everywhere, sustainably. I mean, that's a purpose that we set for ourselves. And we are a company which is focused on building solutions on imaging, diagnostics, and therapies. And what we have been doing for the last few years is building solutions worldwide and trying to really address the markets in access to care as well. A few things that are actually changing in the world. If you look at it, the world population has gone up. You know, we touched 8 billion people, and we're going to touch, in another 7 years, we'll be touching 9 billion people. And the number of deaths that are occurring because of non-communicable diseases like cancer, stroke, cardiovascular diseases, has gone up to about 73% of the deaths are due to that. And this is really throwing a huge challenge to the world. And how do you manage health? Last year, I lost 2 of my friends. One friend, very young, he slept in the previous night, morning he did not wake up. And another friend had a nagging cough for almost 6 to 7 months, and he was trying to manage it by taking Benadryl. He was living in a village, and he was always told, you have cough, take Benadryl and you will be okay. So it will give him a soothing effect, and he was feeling okay. But after 6 months, when he got himself tested, it was too late. It was an advanced case of cancer, and he passed away. Now, both cases talk about, was that avoidable? Was that something that could have been managed better as a human health? We always try to look at it. Think about it, what's happening, pre-COVID. Pre-COVID, I think the entire world thought we were in a better, healthy situation globally. And it brought us back to earth, giving us a reality check that health is still a huge challenge. In 1978, when World Health Organization declared health for all by year 2000, everyone thought that was a dream that could be achieved very easily. And in 2020, we saw we were nowhere near. And this is a huge challenge. And with the increasing population, and add to that, the number of people that are needed to manage health infrastructure as well as providing health to the mankind is decreasing. We'll be having nearly 10 million shortage of healthcare workers by the year 2030. That's going to really put a huge burden. There are only 2 good news there. One, computational power. That's growing exponentially. If you think about it, it has changed so quickly, so fast. And in adding to that, ability to use internet, the data, that is also increasing exponentially. So these 2 are going to really help us get to a point where we can probably look at a new health scenario that can be managed much better. Software, everyone talks about, earlier speakers talked about how digital is changing. Healthcare, while it is a segment which is considered always careful, safe, because we deal with human health, we are slightly slower in adopting. But our North Star is much, much ambitious. Our ability to look at future, which is going to change the health perspective for human, is very different. I want to give one example of a time when I lived in China, I saw a concept of a family doctor in China. A family doctor in China was always paid by a lot of rich people. They used to have one family doctor who will be paid annual subscription, annual retainership. And they will be paid at the end of the year the money that was agreed. But the catch was, if any person in the family falls ill, there will be a deduction. If two persons fall ill, more deductions. And the same person falls again ill second time, more deduction. That means a doctor, a family doctor, was always incentivized to keep the person healthy, family healthy. That's a huge change in the way we look at it. We are event management in health. Whenever there is an event that happens, we go to a hospital, but not otherwise. Software, Gen AI, we are talking about, these are going to change the health scenario in the future in a big way. We are talking about ability to create, ability to understand human health better. Can we look at creating or mimicking my own health for the future? I mean, this is what we are trying to look at from Siemens Healthineers point of view. Ability to touch, build a mimicking digital twin which can be used in two ways. One is from a clinician perspective. Can a clinician experiment all that he wants to experiment before he treats you, and find out what is the most optimal way of treating you and treat on a real person? The second, it's a North Star, where all of us can have our own digital twin on our mobile phone, which can be telling us even before, few months before, that there's something happening you need to be careful about. How do you build that? And that's what we are trying to do that. A few underlining technologies. Look at the way we used to see the CT scans. CT scans in the year 1970s, when it got introduced, they were as blurry as that, and today's CT scans on the right side, what you can see, is as clear as this. This is the latest technology on photon counting, which measures the number of photons crossing the human body. These are giving us intricate details of human health in one or other way. I'm just giving this as an example, but there are many other examples of human understanding, body understanding, the health understanding, disease understanding. Maybe it is your watch. Maybe the new rings which are coming out now, Indian company has come up with a new ring which can actually measure your health in a lot better way. All these inputs that are coming from multiple sources, your food habits, your records that are coming from all the medical check. Talk about NDHM, National Digital Health Mission. What we are trying to look at in the verticalization of data of a patient. All the data that is coming will give a historic understanding of how a person is doing in health. Now, this can be captured, and that can become a basis for building a human digital twin. And that can actually be a future game changer from moving of disease management to a health management or a wellness management of humans in the future. And that's what we are excited about. And what I want to start with is this image, one small video which talks about what the future of healthcare on digital twin looks like.
In the decades ahead, healthcare will undergo dramatic transformations. Medicine will become more precise. Value will shape care delivery. Patients will become empowered consumers. And digitalization will transform every facet of healthcare. Patients will have a digital twin, a customized computational model of themselves, enabling Dr. Clive to anticipate illness, guide therapy options, and predict outcomes of procedures. Expanding precision medicine will enable radiologists to make highly specific diagnoses for Stephen without unwarranted variations. AI-powered decision models, fed by vast population health data, will improve diagnostic accuracy. will become anticipatory, organized around Paula's medical conditions, and available around the clock, transforming care delivery. Multidisciplinary, highly productive care teams structured around patients and their needs will collaboratively deliver the full cycle of care. All interactions with John will become convenient, personalized, and compassionate, improving patient experience. Supported by real-time monitoring and guidance, John will become more empowered and have physical and virtual access to care when and where he needs it. At Siemens Healthineers, our mission is clear. We pioneer breakthroughs in healthcare for everyone, everywhere.
So with that, I can say one thing. Our goal is to move healthcare industry to managing wellness and creating lives of people, moving the lives of people into building a quality of life that can be much, much better. So with that, thank you.